So we have a brand new baby here. She was just born. So the very first thing that we're going to do is we're going to wipe her off. We're going to look and check and see how much Vernix she has. She doesn't have a lot. That's the white cheesy kind of lubricant that's on them. We're going to wipe her off. That's going to help her to lose, to prevent her from losing heat through evaporation. Now we're also going to put her in the radiant warmer. That's also going to help prevent heat loss through evaporation. What we would also do is if we were weighing her right now, we would put a towel between her and the scale. That's going to prevent heat loss through conduction. And we're also going to make sure she's not around any cool drafts. That's going to prevent heat loss through convection. And if she was ready to go back to mommy right now, we would put her on mommy's chest and cover her up. And that would prevent heat loss by radiation, because the heat from mommy's body would go on to her. Now, we're going to be checking her APGARs. Those measure heart rate, respirations, her color, and her grimace. So while we're looking at her, her color's good. She's nice and pink. We're going to listen to her heart. We're going to listen to it apically, but on a newborn, that's about the center of her chest. We're going to listen for 1 full minute. While we're doing this, we're also going to check her respirations. So let's check her out. Okay, great. Her heart rate is 120. It should be between 110 and 160 right now. Her respirations are 40. They should be between 30 and 60. She's doing really good. She's not showing any signs of respiratory distress. Her nares aren't flaring. She's not grunting. She's not retracting when she breathes, so that's great. We're going to now check her grimace, which is one of her reflexes. When I go to suction her, she pulls away. So that's a positive right there. So she's looking great so far. Now we're going to check her mouth. We would don gloves and take my pinky and stick in her mouth. And we're going to check first for the sucking reflex. She has that, so that's great. We're going to check for a cleft palate. She doesn't have that, so that's great. We're also feeling around for Epstein pearls. Those are very similar to Mila. You don't have to worry about that. They go away on their own. But she doesn't have any of those. And we're going to go just a little bit further and check her gag reflex, which she has, so that's great as well. So now we're going to remove her hands, or fingers from her mouth. Make sure she's secure. Take our gloves off. Do proper hand hygiene. Now I'm going to take my finger and rub the side of her cheek. As I do that, she should turn her head towards my finger. That's the rooting reflex. She's going to have that when she's nursing or when she's just feeding in general. Now we're going to check her face. We're going to look for milia, which is essentially just baby acne. She doesn't have any, but if she did, I would instruct the mother and the father, don't pop, because it can cause a secondary infection. They will go away on their own. While we're looking for this, I'm also looking for port wine stains, which are permanent. They often and usually occur on the face, neck, upper torso, and arms. She doesn't have that, but if she did, I would let the parents know this is normal. Unfortunately, there's no way to get rid of it other than surgical intervention. But I would also make sure that they had the resources to help them deal with that as she's growing up, and to also deal with it socially, because I know that would be a strain on them as well. Now we're also looking for stork bites, which are just small, pink, easily blanching areas. They usually occur on the eyes, in between the eyes, on the lips, on the nape of the neck. She doesn't have any of those. If she did, completely normal. We're just looking for them to definitely chart if she had them. And we're also looking for Mongolian spots. Now, Mongolian spots have a blue tinge to them. They look a lot like bruises. And unfortunately, they're often mixed up for abuse. So we're looking for that to make sure that she doesn't have any of that. It presents a lot on the buttocks. She doesn't have any of that, which is great. Okay, I'm going to look at her ears. I'm going to make sure that nothing is blocking her canals, which it's not. That's great. I'm also going to take her pinna and pull it in. And when I turn loose of it, it should retract straight back, which it did. If it did not, this would be a sign to me that she was a preterm baby, but she's a full-term baby. We're also going to check, make sure there's no deformities in her ears, in the formation of her ears. Now we're going to look at her head. We're going to look and check her fontanelles. Her anterior fontanelle should be diamond shaped. Her posterior fontanelle should be triangular shaped. They shouldn't be closed, and they're not. Her suture lines are not together, which is great, but you don't want it fused together yet. And this will all close between 12 and 18 months. So we're also looking to see if she has any cephalahematomas, which will be on either side of her head. That's just bruising, a little bit of swelling. Oftentimes if they use forceps on them to help them get out of the birthing canal, they'll have those. She doesn't have any of those. We're also looking to see if she has any swelling that crosses the suture line. She doesn't. If she did, that would be a normal occurrence. We would just instruct the parents, and we would monitor it as well to make sure that no changes occurred from that. So as we're looking at her, we're also making sure that there's no bulging in her soft spot. That would tell me that there was some cranial pressure increase that we would really need to be looking into. We're also looking to make sure it's not sunken in, because that can be a sign of dehydration. So she's good on that. We're going to look at her little eyes. There should be a blue tinge to them. Shouldn't be any tears or discharge, and there's not. So at this time, we will put the antibiotic cream on her eyes. She's looking good. So now we're going to look at her neck. Make sure that her trach is midline. Make sure that there's no lumps, bumps, or any nodules that shouldn't be there. There's not. So now we're going to look at her arms. We're going to check her brachial pulses. They're strong. We're going to do the arm reflex test, where if we pull them back, they go straight back up. She's doing great on that. So now we're going to check her hands, make sure there's no polydactyly, syndactyly, no simians, creases. We're also going to check her feet for polydactyly and syndactyly as well. Polydactyly means there's an extra finger or toe that shouldn't be there, and syndactyly is webbed like a duck. So she doesn't have any of that. We're also going to check her hands for Simian's crease, which is a marker for Down syndrome. She doesn't have that, so that's great. We're going to take her arm and we're going to fold it across her body, and her little elbow should be midline with her body. That's called scarf sign. She has that. That's great. That tells me she's a full-term baby. We're also going to take her hand and bend it down to make a square. That shows me that she has good flexion in her wrist. She has that. That's square window. That's great. So now we're going to move on, and we're going to look at her breast. We're going to make sure that they're budding 5 to 10 millimeters. We're going to make sure that there's no discharge, any lactation evident. That would be called witch's milk. They can also become engorged, which just occurs from the mother's hormones, and it resolves on its own. It can be quite scary for a mother to see that at first, but it is quite normal. So now we're going to look at her abdomen. We're going to listen for positive bowel sounds in all 4 quadrants. Alright, all 4 quadrants are active and positive. I don't feel any lumps, bumps, anything that shouldn't be there. Now we're going to look at her umbilicus. There should be 3 vessels in her umbilicus, 2 arteries that carry deoxygenated blood away from the baby, and 1 vein that carries oxygenated blood from the mother to the baby. She has that. At this time, we're going to put Wharton's jelly on it. That helps constrict those vessels and draw them in. They can also, after that Wharton's jelly has been on there for a little bit, they can test it for drug use of the mother. They can also do a genealogical study as to how far back did the mother do those drugs while this baby was in utero. So her umbilicus looks good. We're going to make sure that it's open to air so that it will heal. Now we're going to move on to her legs. So with her legs, we are going to flex her legs up and over and make sure that there's no clicking. If there was a clicking, that would tell me that her femur is slipping out of her acetabulum when she moves. Now, to alleviate that, we would triple diaper her just to abduct that femur a little bit and let it sit farther in that acetabulum and let the bone grow around it so that she wouldn't have to deal with that. Now, while I'm looking at her legs, I'm making sure that they're symmetrical. Is one higher than the other? Is one flopping to the side? So I'm going to flip her over and look at her gluteal creases. They should be even, and there should be the same amount on both sides. If there's not, that tells me that there's hip dysplasia, and the way to alleviate that, the intervention, is to also triple diaper her and just abduct those hips and help them to sit back in there and to alleviate that dysplasia. Now, when we're looking at her legs, we've already looked for polydactyly and cystodactyly. So now we're looking at her foot. It should be covered 2/3 of the way with creases. That tells me she's a full-term baby. Now, we're going to look for the Babinski reflex. Now, to do that, of course, this doll has a very small foot, so I'm going to use my thumb. But you would take your hand from the ball of the foot to the side of the foot and just rub it. When you do that, the big toe should dorsiflex, and the other toes will fan out. So we're doing that. She did good with that. We're also going to look for acrocyanosis, which is bluing of the hands and the feet. Nothing wrong with that. It's perfectly normal. It's just vasocirculation isn't as good in the extremities sometimes. That alleviates between a week and a couple months after birth. She doesn't have that, so that's great. Now, while we're here, we're going to check out her genitalia. So she's a girl. So her labia majora is covering her labia minora. The clitoris is not protruding, so that tells me she's a full-term baby. Were she a male, we would check to make sure that the scrotum was covered in rugae. We would be able to palpate it. Wouldn't be any abnormal lumps, bumps, anything that shouldn't be there. Of course, the foreskin would be intact as a newborn, and the meatus would be center. Now we're going to flip her over and look at her back. We're going to make sure that her spine is midline and that there's no tufts of hair on the small of her back. If there was, that would be a marker, and that would tell me that it's likely she has spina bifida. So we're going to flip her back over. Now we did her APGARs at the beginning of the assessment. You would do it again in 5 minutes. If you have an APGAR score between 1 and 3, you're going to need to do resuscitation. The child is either not breathing, it's having a very hard time breathing. You might have to do chest compressions. If you had a score between 3 and 7, you would need to do what's called tactile stimulation. Now that can come from flicking the bottom of the foot or stimulating the back. You're just really trying to get them alert and trying to get them to transition a little quicker, to wake up. And usually that works pretty quickly. If you saw that applying tactile stimulation it still wasn't working, they were getting worse, maybe they started to retract, then you would want to start resuscitation. If you have a score between 8 and 10, there's no intervention needed. You just observe them, allow for transition, just monitor them. So at this time, our little girl here is perfectly fine. She's healthy. So what we would do now, I would chart everything that I found, anything that might be abnormal. Maybe it's something that it needs to have the doctor's attention. I'm going to chart that. Even if it wasn't abnormal, I'm still going to chart it and let the nurse know my findings. And then we're going to wrap her up, put a hat on her to prevent more heat loss through evaporation, and then we're going to take her to mother so that she can initiate nursing and bonding.